Hi guys, so I'm here with another interesting topic today for you all about prescription. Prescription means written dated form but not verbal, written by a doctor, dentist and a veterinary. It is specified by the name of the drug, dose, dosage form, frequency of administration, total quantity. It can be also inhalers, needles or any other surgical item. Prescription is doctor's interpretation of the drug treatment. So pharmacist's responsibility is to provide medicine to the patient with correct instructions, like how to drink and what time you should drink, and is it before meals or after meals. General rules is a prescription only medicine is only available in the pharmacy, dispensed by the pharmacist or under the supervision of the pharmacist. Since prescription is a written order, it shouldn't be altered without prescriber's order. If there is any fault in the prescription, you have to give a call to the doctor and ask him whether it can be altered or not. Since prescription is a legal form, it cannot be misused and limit drug. Every prescription should be checked by a pharmacist to minimize errors by the prescriber. Every prescription should be checked by a pharmacist to minimize any errors, because in a poorly written prescription there can be errors and doctors also can make error. When receiving a prescription, a pharmacy should follow some rules. Firstly, date should be checked. Check the patient's details, safety like patient's name, age and sex of the patient, address of the patient, and in case you can also ask the number of the patient, because in case if you make any errors, you can give them a call and make it right. Age of the patient is also important. Make sure you give them a token number, because you can also make errors while giving the patient the correct medicine, because there can be same names with two different patients. The dose is also very important. A pharmacist should check them correctly with their age, especially for a child and an infant. Prescription should be copied to the prescription book before it's issued. And developed countries actually have a computerized patient's data with their reference number. Mark the prescription with a rubber stamp with place and date of dispensing to indicate that it is already issued. Pharmacist can dispense either generic or particular brand of a drug unless a prescriber indicates a specific brand, because some patients don't like if it's issued another brand. This can dispense either generic or one particular brand of a drug unless prescriber indicates a specific brand. You can never prescribe another brand without patient's consent. You should always label correctly. Before dispensing, the label should be checked by a pharmacist to ensure the right product has been labeled. Patients should be dispensed with appropriate counseling and advice. Dispense the product as soon as you receive the prescription, because speed is very important. If any errors in the prescription, please don't criticize, because humans can make mistakes. Repeat prescription. Pharmacist should always check that if it says repeat, only then he can dispense it again. If prescription is dispensed, then keep a record. Return the prescription to the patient. What does a prescription consist? Prescription consists of following parts: prescriber officer's information such as name, address, telephone number, number of the date of the prescription. Patient information such as full name of patient and address, age, sex, etc. Superscription or symbol. Latin verb receive means take through or you take. Also, the symbol RX indicates this is an inscription. This is the body or principal part of the prescription order. It contains names and quantities of the drugs prescribed. Prescription requiring compound contains name and quantities of each ingredient required. Subscription. This part contains dispensing direction to the pharmacist by the prescriber. What quantity to be dispensed, the Latin word miti is used to indicate translates as send. Transaction. Sigma or label. This part contains direction for the patient on the uses of product. The direction in the sigma are commonly used abbreviated forms of Latin or English terms. Signature, name, SLMC number and qualification of the prescriber. This is all for today. If you want more details, please subscribe and mail me for any other instructions.